Hi, everyone. Welcome. Thank you so much for joining us today. We're really excited to have this webinar on genetic counseling. I know it's a little bit different than some of the webinars that we might have had in the past, but again, we're really excited to really put this on for you all. So before we get started, my name is Mauro Perez. I'm a college success advisor here at Fulfillment Fund. And I'm going to go ahead and introduce the two individuals that are going to be facilitating today's webinar. So today we have Jesus Resendiz, who is a genetic counseling student at the Keck Graduate Institute in Claremont, who just finished up his first year. So we were just talking a little bit about that. So congratulations, Jesus. So Jesus received his BS at the University of Laverne, where he majored in psychology and minored in biology. And then we also have Charité Ricker, I hope I'm pronouncing that correctly, who is a genetic counselor and clinical instructor of medicine at the University of Southern California, Keck School of Medicine. Ms. Ricker has almost 20 years experience as a counselor genetic counselor, and the majority of her clinical work has been in the underserved patient setting where she is committed to improving access to genetic services. She received her BS in genetics from Texas A&M University, her MS in genetic counseling from CSU Northridge, and is currently working on a PhD in health behavior research from USC. So I'll go ahead and pass it off to them so that they can take it away.
Cool, awesome. Well, before I get started, I do want to thank Gus and Mauro and Fulfillment Fund for giving Charité and I the opportunity to talk to all of you. So definitely looking forward to that. And before we get started, I do want to give like a brief overview of what we will be covering. So first, we'll start off with genetic counseling presentation, just giving an overall look at the career option. And then once we're done with that, we will move on to a Q&A in which during that portion, Charité and I will talk about our experiences and how we found the field and what our journeys have looked like, as well as Charité can definitely talk about her experience being in the field. And then I can just talk a little bit more about the admissions process, as well as how graduate school is like. Okay, and we do want this to be interactive as possible. So if you have any questions throughout the presentations, feel free to unmute yourself, or you can drop your question in the chat. And either myself or Charité will be answering those questions, okay? Okay, so before we get started, I do want to ask a question to all of you, and like I mentioned, feel free to unmute yourself or put your answer in the chat. So what comes to mind when you hear genetic counseling, or when you hear the word genetic counselor? I thought this picture was hilarious, but is anyone familiar with the profession already, or does anyone know a genetic counselor? And it's okay if you don't know. I certainly did not know prior to undergrad, but Charité, if you can see if there's any answers in the chat. If not, I can definitely move on to the next slide.
Nothing yet.
Cool, awesome. Yeah, it's definitely a very niche and very small field. So again, I wouldn't expect many to know about this profession. So who are genetic counselors? So genetic counselors are patient and family advocates. They support patients in making healthcare informed decisions. They provide patients with support, and they also give information about how inherited conditions are passed down, or about genetic conditions themselves and how they affect them, as well as their family members. They are experts in medical genetics, as well as have a great, strong skill set in counseling as well. And overall, they are translators of genetic information. And so what do genetic counselors do? So usually in a clinical setting, genetic counselors meet with patients one-on-one for a variety of different reasons. They may talk, and it's usually if their provider is suspicious, or for a genetic condition, or if they have a family history of a genetic condition. And so they'll talk to the patient about the referral. They'll often take what's called pedigree or a family history. And this, you can see this on the lower right-hand corner. We would call it a pedigree. The circles are females and the squares are males. And the filled in circles or squares are usually to depict individuals who are affected with something. And so they provide risk assessment. And so you might be asking yourself, well, what does that mean? So basically it means that genetic counselors talk to patients about the probability of them having a genetic condition, the probability of that genetic condition being passed down, as well as if they will manifest certain features or symptoms related to a specific genetic condition. And they also offer support, and they also facilitate decision-making. I think it's very important to note that genetic counselors do not tell patients what to do. They simply educate patients about their options and let the patients decide. And again, ultimately, they explain test results and what that means for them and for their family. And so genetic counselors do have to be advanced or proficient and need to have a good comprehension of genetics, medical genetics specifically, as well as psychosocial skills. And specifically on this slide, we'll highlight some of the genetic information that genetic counselors will need to know in order to be effective in talking to patients. So they need to know what genetic variations are. And these are just simply genetic changes in a gene. They may or may not be harmful depending on that change. And genetic counselors must be able to know and properly explain what different inheritance patterns are in order for the patient to understand, as well as how different genetic conditions manifest and how they work and the different features and mechanisms that they may have. And so genetic counselors do need to be knowledgeable in embryology, in bioinformatics, biostatistics, cancer, cardiology, and metabolics, as well as pharmacogenomics. And then these are all courses that someone who is in graduate school will be taking throughout their experience in their master's program. And so some of the psychosocial skills that genetic counselors will need is definitely explore the patient's feelings, whether that's shame, guilt, fear, relief, or happy. They need to be able to explore those feelings with their patient because in a genetic counseling session, it is a client-centered session. And so genetic counselors need to have empathy and be able to empathize with their patients, as well as have crisis intervention skills and be able to understand and identify psychological defenses, family dynamics, be able to identify different coping mechanisms, as well as the process of grief and understand the different reactions that people may have to illness in general. And so genetic counselors are able to work in a variety of different settings. People may be most familiar with the clinic setting where genetic counselors work in hospitals or in healthcare facilities. They may also work at universities, laboratories, or in nonprofits, and in government agencies. As advancements in genetic technology and testing is made, it is important to have genetic counselors involved in policymaking and in government legislation, which really pushes the boundaries of the roles of genetic counselors. Usually in a nonprofit setting, genetic counselors may work with the community in the format of educating the public, or they may work with a public health organization advocating for their patients. And so there are a variety of different specialty areas that genetic counselors can go into. Some of these specialties include, well, the top three include cancer, prenatal, and pediatrics. But these are not the only ones that genetic counselors are in. We currently see genetic counselors in neurology, pharmacogenetics, metabolic, and cardiovascular disease. So because there are thousands of known genetic conditions, genetic counselors have the opportunity to focus on either a disease type and a specific patient population group. And I will be talking about the three main ones, starting with prenatal. And so genetic counselors in a prenatal setting will typically see expecting mothers. And the reason for the expecting mothers to be referred to a genetic counselor may be due to their age, just because once a woman reaches a certain age, they might be more at risk of developing certain genetic conditions. If they find any abnormal ultrasound findings while they're doing the ultrasound scans, as well as if there's a family history of a genetic condition, or if there's multiple miscarriages, or if there's an abnormal result in blood work. And in a cancer setting, genetic counselors typically see adults. Sometimes they can see children as well, depending. There's pediatric oncology, and then there's adult oncology. So it really depends what setting you're in. But a patient might see a genetic counselor in a cancer setting if they have a personal diagnosis of cancer, usually at an earlier age, or if their type of cancer has some specific characteristic that makes us suspicious for a hereditary cancer syndrome, or if they, again, have a family history of cancer. And one of the cool things with genetic counselors in a cancer setting is if you do find something, or if you do find that someone is predisposed to a certain genetic condition, there's things that they can do to either minimize those risks or to catch things early. So now in a pediatric setting, pediatric genetic counselors, they typically work with families, and a family or a child might be referred to a genetic counselor if they have like abnormal growth, if there's an abnormal newborn screening, if there's some sort of autism diagnosis, if there's any abnormalities in how their bone or heart are forming, or if there's any type of developmental delays. So if a child is not meeting certain milestones, like they're not walking when they're supposed to, or they're not talking when they're supposed to, and there's any learning disorders, or if there's any physical abnormalities as well. And so we also see that genetic counselors have non-traditional roles as well. And so they, again, can work in patient advocacy, in public health legislation, in laboratories, specifically genetic testing laboratories, as well as in industry. Genetic counselors can also work in genetic testing marketing, as well as public health organizations and nonprofits. And you do see genetic counselors doing research as well. Okay, so now I'm just going to talk about the professional status survey. This is a survey that is administered by the Professional Society of Genetic Counselors, which is called the National Society of Genetic Counselors, in which its purpose is to offer an inside view on the profession throughout the years. It is sent out yearly, and it essentially collects information like salary ranges, benefits, work environment, demographics, and job satisfaction. And so it is sent out to genetic counselors who are members of this professional society or diplomats of the American Board of Genetic Counseling. And so Out of the 5,437 possible respondents, 3,006 completed the survey, which resulted in a 55% response rate. And so here we can see that 53% of respondents stated that they work directly with patient care. And usually this is seen in clinics. 25% of respondents stated that they worked in non-direct patient care. And again, this is typically seen in genetic counselors who work in industry or in laboratories. And 22% responded saying that they did a little bit of both direct and non-direct patient care. And 90% of respondents mentioned that they worked full-time, and 10% mentioned that they work part-time. And so you might be asking, well, how much do genetic counselors make? So based on this report, the average salary for a new graduate in a full-time position, and this is just the national average, was $76,702 yearly salary. And a genetic counselor who has been in the field for a number of years reported a salary of $97,976. But I do want to highlight that in California, it's a bit different. That the cost, because of the cost of living, in Los Angeles, the genetic counselors who worked here reported making roughly $112,000 a year. And in Irvine, it was $114,677, which is just a tad more. And in San Diego was $105,000, and in San Francisco reported the most, which was $122,574, which makes sense because San Francisco is expensive. And so I think a really great question to ask when you're searching any profession is, well, are the people who work in that profession, are they happy? Are they satisfied with the career? So based on this survey, genetic counselors reported a 89% saying that they were satisfied or very satisfied with the profession, which is really good to hear. And in terms of demographics, I did want to point out what the demographics for the workforce in genetic counseling looks like. So we do see that 90% of the workforce reported that they were white or Caucasian, that came from white or Caucasian ethnicity. And within that, around, I think, 70 reported that they were Hispanic or Latinx. And I do show this just because right now there is a current push to diversify the workforce. And I'll talk a little bit more about some programs that have been developed to try to accomplish that later on in some of the slides. So adaptability. Whoops. Okay. So just based off, so this survey was done in January of 2021, and these results just came out, I believe, in April or May. So this information gave us some information about how genetic counselors were able to adapt to the COVID-19 pandemic. And we did see that 91% of genetic counselors reported working as part or all of their position remotely in 2020. And of those, 85% of genetic counselors reported working remotely, had worked with patients directly, and 99% of those genetic counselors were not working with patients directly. And so we do see a huge change since 2019, when only 40% of the workforce was working remotely. and some more interesting info. So according to the US News, the genetic counseling profession was ranked within the top 10 best healthcare support jobs. And according to the Bureau of Labor Statistics, they projected from the year 2019 to 2029 that there would be a 21% projected growth. So now I'm just going to talk about the educational path of what it takes to become a genetic counselor. So you will need a bachelor's degree, and it doesn't necessarily matter what your major is, as long as you take the prerequisite courses required in order to get into a graduate program, which would be a master's, which typically ranges around 2 years. And so I did put on here that it is helpful if you're majoring in any of the STEM fields or any social science or any of those related fields. But again, honestly, that doesn't matter as long as you take the prerequisite courses. And I'll talk a little bit about those courses on a future slide. And so the master's program, there's around 51 accredited genetic counseling programs, with 4 in Canada. And this has definitely changed since when I was first interested. I remember there wasn't as much. So it's really nice to see that more programs have been developed since then. But usually what you would do in these master's program is you will do a lot of genetics didactic coursework, as well as some psychosocial courses. And you will also be doing what are called clinical rotations. And this is where you have that hands-on, where you are able to get those hands-on experience and get to work with patients and do these genetic counseling sessions. It is a requirement too in your graduate program to do research, whether that's in the form of a thesis or if that's a capstone. So if you pass all of these, then you graduate, and the ultimate last step would be to take what are called the boards. And this is where you're basically tested on what you learned in your graduate program. And then if you pass the boards, then you are able to practice seeing patients. Licensure is a little bit different. I believe it's just more paperwork, if I'm not mistaken, Charité. And I think it's just a little bit more money, I believe.
Well, it's dependent on the state you practice in. And if a state has licensure, you have to be licensed in that state in order to call yourself a genetic counselor and work in that state. And so mostly it's just showing that you've done your continuing education and that you've passed the boards and that you're qualified. So it is just more paperwork, but it does allow you to practice in the state you live, or if you're in a company. There are telehealth companies where a counselor might live in one state but be seeing patients throughout the country, and then they have to maintain licensure in multiple states in order to counsel people outside of their own state. So it has to do with the state laws where you're practicing. And not all states have licensure, so it's not necessarily relevant in every state. But California does, so.
Yeah. But yeah, and so now I'm just gonna go more about the prerequisites in order to get into a graduate program. So like I mentioned, you do need a bachelor's degree, and I would say a competitive GPA. I think the average is like a 3.5, but I think anything above a 3.0 would be good. And doing some of the coursework required in order to get into these graduate programs are biology, chemistry, OChem, biochem, genetics, statistics, and psychology. And depending on the program, they might require different coursework to be completed. But again, that would just depend. The GRE exam is something that when I was going through the application process was required. But because of COVID, I know a lot of programs waived it. I'm not sure if they're bringing that back again. But it really, I think it would, again, just depend on the program. Again, if you are an international student, I know programs do require the TOEFL exam, as well as a personal statement. And usually programs require students to have some sort of advocacy experience, whether that's crisis counseling, bereavement, or working with individuals with genetic conditions or disabilities. Genetic counseling programs do want to see that you do have those interpersonal skills. And it also helps if you shadow a genetic counselor. I know that sometimes that's not always the case, and you don't necessarily need it, but it does help the genetic counseling programs know that you know what you're getting yourself into. And research and laboratory experience can definitely boost your application. Again, it's not necessarily required. And again, programs typically do need 3 letters of rec. Some require more, some require less. I know they usually do require one from a professor, usually one from a place that you had done some advocacy work. And the last one, it really just depends on the program. They might be asking for a genetic counselor to give you a letter of rec, or anybody who has seen your work ethic. So applying to programs. So I did want to highlight some of the programs in California. I remember when I first started looking, UCI and Stanford were the only 2, but that was back in, I think, 2014. Yeah, 2014. So it's really, really cool to see some of these newer programs being developed. KGI has been around for 3 years, and UCLA just started up their program last year, and UCSF just started their program this year. So they just admitted their first class. And so just going along with the theme of applying to programs. So the application process in order to get into a genetic counseling program is different from what is typically seen. It used to be that you would just apply to these programs and just they would make a decision whether they accepted you or not. But now you have to go through what's called the match. And it's essentially the same thing that medical students go through when they're trying to match to the different residency or fellowships. I think it's on their 3rd year of med school. But essentially what it is a prospective student will register for the match, and it's a one-time fee of $100. And then after they pay that registration fee, they will apply to the schools that they are interested in. And from there, once the applications are closed, the different schools or programs will send out interviews to the students that they might be interested in having. And that time period is usually from January to February, sometimes March. And so once the students and the programs are done interviewing, the students will rank their program with one being their top choice. And then just going along from there. And then the program themselves will rank the students. And each program will accept a certain amount of students. I believe the average is usually around 10. Some programs accept 5 students. I believe the largest program is Sarah Lawrence. So they take around like 25 students, somewhere around there. But again, that really just depends on the program. And then on April 23rd, we have what's called match day. So that's the day whether you find out if you match to a program or if you didn't. And you can only be matched to one program. And so the way this works is it's an algorithm. So the algorithm tries to pair you with your top choice, keeping in mind the program's top choice of students that they want. So that's what has been implemented since, I think, 2017. Yeah, 2017. But yeah, so a little different from your typical admissions process. And so I did want to just highlight the results from this past application cycle. And so on here, you can see the number of applicants who registered for the match was 2,069, and applicants who withdrew or did not submit their ranks was around 961. And that can be for a variety of different reasons. They may have not received any interviews, or they may have changed their minds. But the number of students who participated in the match and submitted their ranks was 1,108. So as you can see here in the results, 49.5% of applicants were able to be matched, and 50.5 unfortunately were not able to be matched. And I do bring up the slide just to highlight that it's a very competitive process, and it's not uncommon to see applicants applying multiple times. And for most programs, that actually looks really good because it shows that you're persistent. I applied twice, took some years in between to just strengthen my application. But again, it's not uncommon to see applicants applying multiple times. And so I did want to provide some resources if you are interested. The National Society of Genetic Counselors, they have this tool where you can find a genetic counselor by just going on their website, and depending on what specialty you might be interested in, just putting that information there. And that's what I did after the first time that I did not match. I spoke to a few genetic counselors and just got their perspective on how to be a better applicant, which is really useful. So if you are interested, I do recommend using this, but it's a really cool tool that they offer. And I did also want to offer another resource, it's a genetic counseling toolkit for students who are interested in. And this is put by the Gene Council. And if you click on this link here, it'll take you to this website that provides you with articles about genetic counseling, as well as podcasts and other resources as well. It also points out genetic counselors have their own journal as well. And depending on your institution, you might be able to access that for free. So definitely worth looking into if you're interested. And I did want to show this video that, is it already playing? Oh no, not yet. Okay, so I did want to show this video. So I did mention that the genetic counseling profession is trying to help minority students, as well as professionals, get into the field and succeed. And then this is one of the programs that has been implemented.
Introducing a new way for minority students to connect with genetic professionals, the Minority Genetic Professionals Network, or MGPN, a project of the Western States Regional Genetics Network. The MGPN is a free collaboration between racial and ethnic minority students in high school, undergraduate, graduate, and medical school programs with racial and ethnic minority genetic professionals like MD geneticists, genetic counselors, and nurses specializing in genetics. The MGPN can benefit students in many ways. Students can be matched with a genetic professional with similar interests in the MGPN's mentorship program. Our private discussion forums on both desktop and mobile apps allow students interested in genetic careers to text and talk among themselves. These forums also allow MGPN members to discuss topics which range from the level of education to regional, race, and ethnicity-related discussions. Become a member of the MGPN today at minoritygenetics.org and follow us on our Twitter and Instagram social media platforms.
Yeah, and with that,
introducing a new way for my.
All right. And so with that, we conclude this portion of the presentation. And so if you have any questions, again, feel free to unmute yourself or put it in the chat. But I think now we'll just go on to the Q&A part. Are there any questions? I did see the chat thing light up. I just can't see it.
That was just me putting links into the chat.
Oh, okay, cool, awesome.
Sorry.
No worries.
Jesus, there is a question. Was this your first choice, and this is from Sophia, or were you planning something else?
First choice in program or first choice in career?
Career, I'm thinking, unless Sophia, if I'm wrong, you can unmute and tell me. Yes, in your career.
Oh yeah. So I actually found out about genetic counseling my freshman year of undergrad. I didn't necessarily know what I wanted to go into. I just knew I wanted to go into the healthcare field. I just didn't know what. I knew I didn't want to be a doctor just because it took so long. And it was a lot for me. But again, I just went out to different career fairs, and there was a biology career fair at my institution, and that's where I actually met a genetic counselor, and she told me about what they do and the different opportunities that they have. So I was like, wow, this is interesting. And so just with the more research I did, the more I really saw myself doing this. So yeah.
When I was in, oh, sorry, go ahead, Jesus.
Oh no, I was just gonna say, I feel like I was pretty early on in terms of deciding what I wanted to do when I was an undergrad. Yeah.
I thought I thought I had wanted to be a physician, and then I failed organic chemistry, and I was like, oh, I need to think about something else. And my undergrad was in genetics. I had always loved genetics. And one of my professors offhandedly mentioned this as a career, but I didn't decide till I was like a junior. And I'm like way older than everybody on this call, I'm assuming. And so this was like 20 something years ago. And there wasn't even one genetic counselor in the city that I went to school in. So I went to school for genetic counseling without really, I think, understanding well what I was getting into. I just thought it was cool because you got to talk to people and do education and talk about genetics. It ended up being a really great fit, and it's but I also, like Jesus, did not get in my first year, and so I had begun to think about different careers in genetics. I'd thought, well, I'd apply one more time, and then if not, then I was thinking about doing genetic nursing or social work, and then working with families with genetic disorders.
Jesus and Charité, I actually had a question in regards to kind of like what you were mentioning right now, that the first time you applied to your programs, you weren't accepted. And then I know Jesus mentioned he took some time to maybe get some experience or work on his application. What were some of the things that you all did in that between the first time you applied and then the next time to, really, I guess, like make your application shine?
I volunteered for hospice. When I didn't get in, I didn't even get an interview my first application round. And so I had spoken to a couple of people who gave me some suggestions. And the main suggestion I got was just to kind of look for more opportunities to grow the skills, like Jesus said, interpersonal skills. And I ended up working with a hospice in the college I was going, or in the city in Texas where I was going to school. And then I think I took a course or two extra that was more focused on some of the psychology, which, because my undergrad was in genetics, we didn't have tons of that. So those were the two main things I did. And then I just kept working and trying to figure out life. But,
yeah, definitely. I remember the first time I applied, I think it was 2017 or 2018, because I took 2 years in between to really get that experience. But I think for me, it was just retaking a couple of courses and just getting a bit more experience in terms of like the genetic counseling field, just because I didn't have a lot, as well as the GRE. The GRE I did poorly on, but my grades were I feel like my grades were average, but I think it was definitely the genetic counseling experience that I got. I reached out to genetic counselors, and it wasn't until one genetic counselor who connected me to Charité, and Charité, I was lucky enough to get a job at USC for an oncology study, which was really helpful in terms of interacting with patients, because that's something that I didn't have prior, but just really good in terms of just seeing the profession and getting that shadowing experience as well. Yeah, it's definitely a very, very intense application process, just because it's very competitive. And so now there's like different special interest groups that definitely help students be more prepared for the application cycle, as well as for the interviews. Yeah.
There was a question in the chat. Are there a lot of people who apply who are changing fields from undergrad or career changing? I don't know across the board, but I will say that I know a fair number of people. We're kind of a small field. There's still fewer than 6,000 of us in the US. And so it's not uncommon for people not to have ever heard of the field or ever had an interaction with a genetic counselor, either in their family or in their own kind of personal health history or interaction with the medical system. And because of that, many people don't find out about genetic counseling until they're already on another track, and it might be kind of an accidental find or something that they get clued into later on. And so I do know a fair number of people who this genetic counseling was either their second career or something that they switched to after, like maybe like myself, where like, I don't know, when I was growing up, if you worked in medicine, you were like either a nurse or a doctor. Like that's all I thought people who worked in hospitals did. Like I was clueless. I didn't know there were things like occupational therapy and like social. I mean, all of those things were unknown to me until I was in college, really, to be honest. And so I think that's not uncommon for people who are kind of healthcare oriented or interested to maybe find out later about the field and then switch. Because it's only a 2-year program, I feel like it's also something that's somewhat easy to transition into if people find out about it after. I also know a lot of people who, not a lot, it's all relative. I know quite a few genetic counselors who were maybe into PhD molecular biology courses. And then they're like, wait, I don't like to be in a lab as much as I thought I did. I want more people contact, or I want to work in translational research where it's not just about the wet lab, but how you get the lab into the clinics. And so they kind of naturally just transitioned over or changed.
Yeah, and Yeah, along those same points, I do know a few people who made career change, but I wouldn't say I know a lot. But yeah, I would, just based off my experience interviewing, I would say there's a lot more people who found genetic counseling and that's what they want to do. But that's just my personal experience when I was going through the.
Well, it is a relatively young profession. Like the first classes graduated, I think, late 70s, right, Jesus, or early 70s or something. So, yeah. So it's not something that's been around all that long. So, but it is growing a lot. And to me, that's what I think is one of the exciting things about the profession, is that genetics and genomics is becoming more and more integrated into many different aspects of medicine. And in order to make it meaningful, you need people who can translate it between kind of physicians and patients, and that's the space that genetic counseling often fills. And so as genetics has a greater impact, there's more opportunity, and then there's also more creative and unique ways that genetic counselors are practicing outside of just that kind of patient-facing role. And again, I mean, just in the 20 years I've been doing this, I've seen huge changes in the types of jobs that are available, how many jobs are available, which is always exciting, and the roles that genetic counselors are filling.
Yeah, and I believe genetic counseling first started in prenatal, right? And since then, there was a lot of genetic counselors in prenatal, but now that's shifted to a lot of genetic counselors being in the cancer setting as well. Yeah.
I have another question for you all. So for students looking at programs, what can you say is like a typical, I don't know, like day or week for a student in a program? Is it like med school where you're looking at 3, 4, 5 hour lectures and tons of reading and review, or is it a little bit different?
Yeah, that's definitely a really good question. And it really just depends on your program. With my program, it's very course intensive the first year. So I was taking like 7 or 8 classes each semester, plus volunteer work that we are required to do, and other extracurricular activities as well. But that was just my program. I know other programs are a bit more spaced out, and some programs start their rotations early. I think UCI starts their rotations pretty early. But it is, you do take a lot of genetic courses and a lot of these psychosocial courses. Yeah, and I would say once you're in a genetic counseling program, all you think about is just, and I'm pretty sure it's the same in med school, where you're just thinking about medicine 24/7. At least for my first year has been just genetics 24/7. Which has been really cool, but sometimes it is a lot. But yeah, it is, you do, because you are required and expected to know all the information by the time you do get to those rotations. So I would say it is intense, but that may vary within program, just how they structure their courses.
I would say, I think most programs though usually have like a first semester that is more course heavy as people transition into observations, and rotations, Sophia, to your question, are clinical, usually clinical kind of assignments where a genetic counseling student is paired with a certified genetic counselor, and they go to clinics together, and during those clinical interactions, there's a component first of observation as the student kind of gets to see what the process is like. And then gradually the students begin to take over parts of those sessions. And so I work in the cancer setting, and when I see a patient, one of the first things we do is take their family history to understand what cancers are diagnosed. And so when I have a student who starts with me, that's also one of the first things I'll transition to them. So they'll start, when they're in clinic with me, they'll, introduce themselves to the patient, explain a little bit about the purpose of their visit, and then take the family history. And then over the course of the rotation, you begin to do more and more parts of the rotation. And the goal is that by the time you graduate, you have done enough of these pieces of sessions to be able to do your own full sessions, but under the observation of a certified counselor who can then provide feedback and discussion about areas for growth and development and kind of forming your own counseling style. There are non-clinical rotations. For example, there are rotations where counseling students may be paired with genetic counselors who work at laboratories, who work in what's called variant classification. And these are counselors who kind of look through the data to be able to better understand the meaning of variations in certain genes. And then that informs the reporting out of that to patients. And so there are other kind of patient-facing rotations, but most of them I would say are in the clinical setting. I think it would be similar if anybody's familiar with what nurses do. They're called preceptorships, I think is the term that nursing uses. So they're similar to that.
So I think we have time for maybe like 1 or 2 more questions. If any students are wondering anything, whether it's about excuse me, the application process, or maybe something specific to Jesus or Charité's experience, feel free to put it in the chat or mute yourself.
Hi, I had a question. So this job seems like something where you have to apply both psychology and science to, and at times it sounds like you may be delivering bad news to families. So I guess I just wanted to ask, like, I guess what that is like for you as a career. I guess how does that impact you as a person, like, and how do you go about delivering these types of news to families or to patients?
That's a really great question, and I think one that anybody who's thinking about working in a helping profession should definitely be thinking about, because there is sometimes a cost that comes with being in that role. I've only worked in cancer genetics, so I'll kind of answer it based on my experience. But in general, many times in genetic counseling, you're interacting with patients and families during some of the more difficult times of their life, either the loss of a pregnancy or news about a very ill child, or the diagnosis of a condition that can't be cured or there's no treatment for. And that can be really difficult news. It's not always bad news though. And I think that sometimes many families have been almost on an odyssey or a quest for many years to understand why they are facing what they're facing, or why their children struggle with what they struggle with. And sometimes, not always, but sometimes genetics can shed light on that and give understanding and a framework. And by understanding why something is happening, it can also sometimes help families prepare for what's ahead and be better able to adapt to the concerns or issues that come up related to that condition. In cancer, most of the conditions that we work with, they do lead to a high risk for cancer. And just to put that in context, that's can often be a risk that is as high as 80 to 90, or even some conditions, 100% lifetime risk for cancer unless interventions are utilized. The positive I see to that is that we're able to then help families identify who in their family has that condition and who doesn't. And the people who don't have the condition are spared from the stress and anxiety of a possible diagnosis and from overscreening, while the individuals that don't have, the individuals who have the risk are able to start doing those things at the right times and ages with an eye towards prevention. And to me, that's a hopeful message. it can be a heavy message. I'm not saying that it isn't, and that sometimes it can be overwhelming to hear this and to see it on paper that this is your risk and this is what you're facing and potentially your family does. But I have found something very, I don't want to use this word lightly, but almost profound in being able to sit with people during those difficult times and understand how they're approaching it, understand what they're experiencing, and in some way being able to empathize and help them. And I don't always have the answers, and I don't always make it better, but I feel almost honored to be part of their process and journey as they face those things. A genetic test doesn't make a condition appear. If the condition's there, it's been in a family often for many generations. It's just what changes is our understanding. And I think it's very empowering to be able to help people gain knowledge and understanding that then they're able to apply back into their lives. But Elizabeth, to your point, that can be a lot sometimes. And there are days when I have to be really mindful of how I kind of debrief. And I have friends and family that are probably tired of hearing my genetic stories, but it's helpful to have colleagues and people who understand, and you're able to kind of relieve some of that kind of stress and pain that you just pick up a little bit. But I always remind myself, whatever I'm feeling at the end of the day, my patients are living with it for the rest of their lives. So I just need to find a way to work through it. But for me, it's very fulfilling. That was a longer answer than I anticipated, but that was a very, very good question.
It was a really great question. And I think too, like, it's important, because one of the things I was thinking about too is like, well, what should someone consider, or what are, like, I don't know, 3 things someone should consider if they're really thinking about going into this field. And I mean, I think that question really kind of sheds light on a really important thing to consider. So again, really great question. And I guess, in these last couple minutes, I wanted to thank you both, Jesus and Charité, for just coming on and sharing your experiences, sharing your knowledge. It was all the information you provided, I think, was really helpful. And I think it does give students that perspective of what to expect if they are going to be pursuing something like this, or a career that's up and coming. So again, thank you so much for sharing that expertise and your knowledge, and Jesus for sharing your contact information. Charité, if you're comfortable with sharing,
I'll put my information. I'll put my information in the chat, but also Jesus knows how to get a hold of me. So if somebody doesn't catch it and they have a question, he'll write. Jesus, you don't mind forwarding it along?
Oh yeah, for sure, definitely.
Again, thank you all so much. I hope you have a great rest of your Wednesday. And again, Jesus and Charité, thank you.